The pandemic is over. We still have a problem with COVID. We're still doing a lot of work on it. But the pandemic is over.
Thanks for joining us this Tuesday. I'm Kurt Siegland.
And I'm Roxanne Evans. Well, those were President Biden's words in an interview with 60 Minutes this weekend, and they really aren't sitting very well with some people, including doctors, who say while we are heading in the right direction, there is still disease out there.
News 12 New Jersey's Jim Vassell spoke with the dean of the Rutgers School of Public Health.
President Biden mildly shaking up the medical sphere in an interview with CBS's 60 Minutes.
The pandemic is over. We still have a problem with COVID. We're still doing a lot of work on it. But the pandemic is over. If you notice, no one's wearing masks. Everybody seems to be in pretty good shape.
Many in the political and medical arenas weren't entirely in agreement. Dr. Anthony Fauci saying this week the U.S. is still not where it needs to be with the virus, noting that there are still about 400 deaths every day.
Are we literally, are we scientifically, are we mathematically over COVID-19 and the pandemic's over? No, we're not. We are not by any means.
Dr. Perry Halkitis is the dean of Rutgers School of Public Medicine.
My worry is that when people hear the pandemic is over, they translate that to mean there's no more disease. And there's very much disease still.
He says the virus doesn't outsmart people. People have allowed it to spread.
We always think that the virus is like doing tricks on us, but in fact, the virus is just a virus. It's like some genetic material in a protein shell, right? It doesn't have a brain, it doesn't have a nervous system, it doesn't have emotions. It's not a villain saying, da, 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 I'm going to go get this person.
Dr. Halkitis says there is one potential silver lining.
We have a bivalent booster now. And if people really are focused and go and get this booster, we may not see the escalation we might see in the absence of the booster. So that's hopeful and promising. But as you know, that depends on human behavior, and human behavior is never very logical.
He recommends people consider getting the new booster along with their flu vaccine as we head into peak season for upper respiratory infections. Jim Vassell, News 12, New Jersey.